Hello everybody, and welcome to today's webinar, Laser Therapy in Rehabilitation. My name is Dr. Rhonda Mostyn, and I'm the Director of Clinical Services and Training at Theralaze. Today we're quite excited to have our guest speaker, Dr. Alta Ferrani, present on this topic. Dr. Ferrani has been working using laser therapy in his 2 rehabilitation clinics for several years now. He's a very experienced practitioner in this area. And without further ado, I'd like to introduce to you Dr. Alta Ferrani.
Thank you, Rhonda. I'd like to welcome our audience to today's seminar on laser therapy in an injury rehabilitation clinic. Before we begin, a little bit about me. I'm a chiropractor. I've been practicing for about 11 years, and I work and manage 2 facilities, one in the west end of Toronto in Etobicoke, called Kidron Valley Rehab, and then one right downtown at Bain College called Bain College Physiotherapy and Rehab. I've got experience in treating a number of different types of patients, motor vehicle accident patients, WSIB, sports injury related patients, the whole gamut. I'm also involved in assessing patients that are involved in medical legal cases and generating reports. I'm a certified K-taping therapist, and I'm also a chiropractic consultant at the Toronto East General WSIB Regional Evaluation Center. I just want to remind the audience that feel free to type any questions you may have on the sidebar. I think it's on the right-hand side of your screen, and we'll address those questions at the end of the web seminar. So before we decided to add or bring on laser therapy, we had been at our downtown facility for about 2 or 3 years, and we were just your typical mom and pop establishment providing the conventional types of therapy with chiropractic, physiotherapy, acupuncture. We're providing therapeutic ultrasound, TENS, IFC, and it was just kind of stagnant, and we looked at the landscape that we were at, and we needed something to give us a bit of a competitive edge because there were so many other established clinics before us in that area. So we did some research and we looked at what we'd like to consider bringing on board, and the research indicated that cold laser therapy was safe and effective modality to treat numerous types of acute and chronic conditions. It's also a fast and efficient type of modality. You can treat an acute condition within 8 to 10 sessions on average. Also, some of our patients that were existing patients in the clinic had come to me and asked, if we would be ever getting laser therapy, and I kind of inquired why they were asking that, and they were going, well, we've been getting these therapies from you, ultrasound and IFC, and we feel okay, but our friend's going to another clinic and all of a sudden his or her pain is decreased by 90%, and that's what we want out of this too. And then we also saw that certain patients were walking into the facility inquiring about laser therapy on their own, or they would come with a referral from a family physician who wanted their patient to get laser therapy. So we decided to take the big leap, and we're glad we did, and we introduced the Theralaze laser unit at both our facilities. So originally when we brought on the laser therapy, it helped us to stay competitive, especially in the downtown area because there were so many established clinics. But what we've noticed now after having it for about 5-6 years is it's actually given us a competitive edge. It's actually separated us from other clinics in the area because our staff, our physiotherapists, our chiropractors are quite knowledgeable in how to apply the laser therapy to a variety of conditions, be it acute or chronic, and our clinical outcomes are quite good and the patients are quite satisfied. And that leads into the next point where if the patients are satisfied, they're then going to feel comfortable to refer their family members and friends. Also, we've noticed we're starting to generate more internal referrals since we've got our laser unit on board. So, for example, the physiotherapist may be seeing a patient, and he or she may be applying the laser, say for an ankle sprain, but then all of a sudden he or she realizes that, it seems like you have flat feet, you may benefit from an orthotic assessment. Then the referral is made to the chiropractor in the office, and then he or she does a gait assessment. Or the patient could be with the chiropractor being treated for, say, a back strain, sprain. Laser therapy is being applied, and notice that, you know what, you've got some other issues on the upper back or the neck, some muscle hypertonicity, maybe you'd benefit from massage therapy. So then again, another referral is made. So this slide is talking about how we integrate laser therapy into a patient's specific treatment program, be it with a solo practitioner or if it's multiple practitioners. In our clinic, we have chiropractors, we have massage therapists, we have physiotherapists, acupuncturists, to name a few. So the first two examples are dealing with motor vehicle accident patients. So the first example is of an MVA patient who presents with a fracture. So the physiotherapist will work on the rehab component of the fractured limb when suitable and other injuries or other injury sites, and the chiropractor will provide a low-level laser therapy to the fracture site and to other injury sites. The one thing to keep in mind with cold laser is that it doesn't heat up, and that's a very important point, because people or patients who present to the facility, they've had a fracture, they've gone for surgery, they may present then with surgical hardware, and that surgical hardware is not a contraindication to laser therapy because it's cold laser, it's not heating up the surgical hardware. You can immediately start treatment, whereas with our conventional types of modalities like IFC, interferential current, TENS units, diagnostic or therapeutic ultrasound, you're not able to do so because that's a contraindication because of the metal. The second example is of a motor vehicle accident patient with soft tissue injuries. Once again, it's co-managed. The physiotherapist provides the rehab component to the injured regions, and then the chiropractor provides the low-level laser therapy to the injured regions, in addition to chiropractic treatment or whatever other interventions he or she deems necessary. For the third example, for your workers' compensation patients or your private patients, usually they're seen by a solo practitioner, be it the chiropractor or the physiotherapist, and whichever practitioner it is, they will provide the low-level laser therapy for treatment in addition to providing a rehab program or other interventions as they see fit. With our orthotic patients, they're usually seen by the chiropractor, and the procedure in my offices is we will conduct our gait assessment, we'll do our palpatory exam, and if the patient has pain and there's a diagnosis of, say, plantar fasciitis or metatarsalgia or Achilles tendonitis, it's recommended that the patient start a course of laser therapy in the interim until the orthotics are provided. And the reason we do it this way is I started to realize that our clinical outcomes are much higher once the patient gets their orthotics. They're able to transition into wearing the orthotics with less pain, less discomfort during their 2-week break-in period. They're able to kind of transition into their pre-injury activities of daily living, get on with their life a lot quicker than otherwise. With our smoking cessation program that we provide at the downtown office, it's co-managed by a chiropractor and an acupuncturist. The chiropractor initially provides the introduction to the patient and what to expect with the program, and then the acupuncturist takes a very detailed history and provides the laser acupuncture treatments for the patient and follows up with the patient. With the last example for our massage therapy patients, one of our massage therapists at our facility is a certified laser technician, and he includes massage with pretty much all of his massage therapy patients. So he will provide 50% of the session for laser and 50% of the session for massage therapy. And we'll go into that a little bit more on some of the slides further on in the session. Time management at our office is crucial because both offices only have one laser unit, so we have to make sure that we're using that unit efficiently so we can maintain an efficient patient flow. A lot of our patients come in over their lunchtime, so they don't have a large window for treatment, so we got to get them in, we got to get them out, we got to get them proper therapeutic benefits so they can go on with the rest of their day. So what we've done to maintain efficient time management is that we've trained our physical therapy assistant to provide the laser therapy. The chiropractor or the physiotherapist who's supervising the patient or taking care of the patient will come in and provide the PTA with the specific parameters. They know how to program the unit, and they know how to access the preloaded protocols. This then allows the chiropractor or the physio to then go on to the next patient. Also, the good thing about the Theralaze unit is it can be used as a hands-free unit. You could use a Velcro strap when you're using the multi-probe to treat a knee, an elbow, or a shoulder. This once again frees up the physio, the chiropractor, or the PTA to go and attend to another patient. Another device that's available that's specifically been designed for the Theralaze laser unit, it's called a boom arm, and it pretty much allows all the probes that are available with the Theralaze unit to be hands-free, whereas a Velcro strap, you can only provide hands-free treatments with the multi-probe. Another good thing about the Theralaze unit is that we can treat a single complaint area within about 10 to 15 minutes, whereas there are other units out there which can take anywhere from 30 minutes to an hour. And once again, like I said before, a lot of our patients are coming in right around their lunchtime, so we have to be very respectful of their time, and we have to make it efficient for them. And secondly, it's not pragmatic for us to tie up a room for an hour because we have so many patients coming in throughout the day. And another thing that we run into a lot, and the way we've been able to handle this is sometimes we'll have two patients coming in at the same half-hour slot, and they both need laser. So what we do is the physical therapy assistant will take one of the patients into the rehab room to start the rehab, and the chiropractor or the physiotherapist may then take the other patient into a treatment room and start the laser, and then after 15-20 minutes the patients switch. So this slide is talking about how at my offices laser is one of the primary first line of care for patients with their conditions. We've noticed that with the Theralaze unit we can treat a number of different acute and chronic conditions, ranging from your acute patients who've sustained a motor vehicle accident, your weekend warrior who he or she has sprained their ankle or hurt their back, from the chronic conditions like osteoarthritis, frozen shoulder, conditions such as TMJ, Achilles tendonitis. You see that a lot with orthotics. Headaches are pretty common with the MVA patients. So we're really getting good results with these kinds of conditions when we use the laser therapy, in addition to other interventions such as chiropractic treatment, K-taping, and a comprehensive rehab program. Another thing is there's going to be certain patients who walk into your office and they just will not feel comfortable with traditional chiropractic treatment, and having the laser unit available is great because it prevents you from losing a patient, because if that patient walks out, the clinic down the road will definitely be able to cater to them, so you never really want to lose a patient. This last point is important, treatment history. From time to time, we've gotten patients in our office. They've been going to another clinic for their condition, and they've heard about laser, so they've decided to switch because they just have not been happy with the treatment results. So they'll come in and they'll go, you know, I've heard about laser, I've been getting some treatment before, but I'm not very happy, and I'd like to try it. So the point here is to take a very detailed treatment history, because you want to know, A, where have they gone and what type of treatment have they received, and have they received any form of laser therapy, be it Theralaze or be it another type of unit, because you want to know how it was applied and what duration was it applied for. Secondly, you want to educate these patients, because they're going to be antsy patients. They're going to be impatient because they've been going to therapy for, say, a number of weeks or maybe even months, and the results just haven't been there, and they're upset and they're kind of down on themselves and the whole process of therapy, and they want some results. So you got to explain to them that, you know, that the laser can be helpful, but it's a co-managed procedure where we're going to try to help you, but you also got to do some of the homework, be it the rehab at home or ice at home. maybe even heated home if necessary. And you got to explain to them that sometimes after treatment you may have a bit of a flare-up. You may experience a little bit more pain, but you know what? That's part of the procedure. That's not the reason not to show up. You got to come back in the next day, and you got to let us know that. So it's important to keep the lines of communication open, actually with all patients, but especially with patients that have gone somewhere else for treatment and now they're coming into your office for hopefully a better therapeutic benefit. Now this is an important slide. It's telling you how you can bill for the laser service. So with our private patients who have extended health insurance, there's no specific coverage for laser therapy, but a chiropractor or a physiotherapist can provide the treatment, and then you can bill for laser therapy under that practitioner. So at our downtown office, the standalone price for laser treatment is $50. If that patient is seeing a chiropractor and they're getting a chiropractic adjustment and they're getting laser therapy, then the fee is increased by $15 to $65. And we've had patients inquire, well, why is it that, why is that, and why can't it be the same price? And we've told them, well, if you look at it this way, a standalone adjustment is $50 and a standalone laser session is $50. So you're actually saving $35 when you're getting both at the same time in your treatment session. That clears things up for the patient. If the patient is seeing the physiotherapist at my office and they are receiving standard physiotherapy treatment and also a laser treatment at the same time, we keep the fee at $65. The $65 is a standard physiotherapy fee at my office. We did try initially to increase the fee by $15, and there was a bit of an outcry by our patients downtown, and they quite clearly told us, well, I don't think it's fair because other offices in this area are not charging extra for that. And at the end of the day, we had to listen to our patients, and we had to adapt our billing schedule or our fee schedule accordingly. So it really all depends on where you're located and what type of local billing practices are present in that area. For individuals that have been involved in a car accident, so this is not for a patient that's under the minor injury guideline. This example is for an approved OCF 18. The laser treatment can be billed as a separate service. For example, if the chiropractor is providing a chiropractic adjustment, you can bill $50 for the adjustment, plus you can bill $50 for the laser treatment. If the physiotherapist is providing the treatment, you could bill separately for a physiotherapy session, and then you can also bill separately for a laser session. With massage therapy in the province of Ontario, laser is part of the accepted modalities that a registered massage therapist can provide and bill for during an individual massage therapy session, as long as the laser therapy constitutes 50% of the treatment time. The slide indicates here that it has to be less than 50, but that's an error. It needs to read that it has to constitute 50% of the massage therapy session. So, for example, if it's a 30-minute massage session and the massage therapist is going to provide laser, so the laser is provided for 15 minutes, and then it's 15 minutes of massage therapy. At our facilities, if the massage therapist is providing just standalone laser therapy, it's $50. If they're providing the laser therapy during a 30-minute massage therapy session, we're going to then add an additional $10. So it's 15 minutes massage and 15 minutes laser. If the laser therapy is provided during a 45-minute session, then we're going to add an additional $10, so it then becomes $70 plus HST. So with any type of the massage therapy treatments, there's always an HST that's added to the service. Now, a little bit more about the MVA. So in Ontario, if a patient has been involved in MVA and their injuries fall under the minor injury guidelines, once approved under the minor injury guideline, the patients have 12 weeks of treatment for an initial approved amount of $2,200. So the compensation is paid out in block fees, so there's no direct fee for service with these patients. So you could have the patient come in 5 days a week to your office, they can get laser 3 days a week, see a physio, see a chiro, but you're only going to get paid in block fees up to a maximum of $2,200. Upon completion of the minor injury guideline, if the patient still requires further treatment, the option is available to submit an OCF-18, but for only a total amount of $1,300. If approved, then the clinic or the practitioner can bill for an individual laser treatment service along with other interventions, as long as the monetary amount does not exceed $1,300. With our WSIB patients, laser therapy can be provided by either the physiotherapist or the chiropractor, similar to the minor injury guideline MVA patients. There is no additional fee that can be charged for the laser therapy for the WSIB patients. The standard fee for a physiotherapy visit is $24, and the standard fee for a chiropractic visit is $25. So in that session, you can provide the laser therapy, but there's nothing else or additional that can be charged. In many cases, massage therapy is also approved by WSIB, especially if it's a patient that falls under the Form 8 treatment, not under the acute low back program of care. So the standalone treatment, standalone fee for massage is $50 plus HST. If the massage therapist is providing laser, an additional charge cannot be provided to the WSI, or an additional charge cannot be billed to the WSIB. They'll pay the standalone $50 plus HST. So having the laser unit in our offices has definitely helped us with our revenue for a number of reasons. Like I mentioned before, the reason we had brought it on board at the initial time was we wanted to give ourselves a competitive edge and set our clinic apart from the other facilities in the area, and it's definitely done that now. It's also opened up a new patient base for us. We're seeing a lot of chronic conditions such as OA, chronic pain, rheumatoid arthritis. We're also getting some patients now coming in for the treatment of addictions for patients who want to quit smoking. We're seeing fracture patients, fracture patients coming in with post-op surgical hardware. We're able to take care of them now as opposed to having to send them away in the past. And we're also getting some athletes coming in at various levels of activity. Now, just an FYI point, so with the rheumatoid arthritis, here's something interesting. You're never going to really be able to cure them from the rheumatoid arthritis because it's going to flare up every now and then. What you're going to be able to do is you're going to be able to provide pain management. So they may come into you with a flare-up, and you're going to probably provide anywhere from 8 to 12 sessions, and then they'll be on their way, and they may come back another 6 to 8 months again. And you'll have to manage their exacerbation or flare-up, and they'll be on their way again. Whereas with the osteoarthritic patient, it's a chronic condition usually, and you can treat them, for about 15 to 20 sessions, and by that time they're pretty good. We had a patient in our office. She's been with me since the first I opened the downtown office, and she had OA of the neck and OA of the knee, and we did our conventional treatments. We did some therapeutic ultrasound, some IFC, and she did okay, but she's one of the patients that had inquired about laser. So once we started her on the laser therapy, she came in for about 22, 25 sessions of laser, and now she's pretty much pain-free. Her last visit, she told me she was 80% better, and she was able to walk up and down the stairs in her house, and really that's all she wanted to do. So now she doesn't come in for treatment anymore, but she comes in once a month to buy her BioFreeze, and this is the only reason I order the BioFreeze is for her. And she's referred her husband to us, and she's also referred a friend of hers to us too. So this kind of leads into the third point where you're going to have patients that have undergone the laser therapy and they're satisfied, and they're going to feel comfortable then referring their friends and their family members. At our facilities, we have a patient incentive program which we explain to all new patients and existing patients that if you feel comfortable to refer a family member or a friend here, you're entitled to a 20-minute complimentary massage as long as that referred patient attends a minimum of 3 sessions of treatment. And a lot of these patients then have turned around and gone back to their family physician and told them about the laser therapy, which has been a great marketing method for us because it hasn't costed us really anything. And we're now getting, like I said before, we're getting some referrals where the family doctor is now indicating laser therapy, which has been great for us. Okay, so we're going to talk about some case studies, some interesting case studies which we've seen in my office recently. So case study number 1 is for a 45-year-old female. She presented to the clinic with left shoulder pain and pretty much a general restricted range of motion of the left shoulder. She was involved in an MVA in June of 2010. She'd gone to a prior clinic, so an important treatment history was required and taken. And she had not received laser, but she had acupuncture, she had acupressure, and the conventional types of modalities. An MRI was taken recently, and it was confirmed that she had a partial tear of the left supraspinatus tendon and left biceps tendonitis. And her treatment consisted of, it was multidisciplinary in nature. She was seen by the chiropractor, a physiotherapist was involved, along with a massage therapist. So her frequency of laser therapy initially was 3 times per week, and then as she got better, it was decreased to 1 time per week, and that's where she's at right now. She comes in once a week for her laser, and most of the focus at this point in time for her is on her active rehab. We're trying to definitely make sure that her left shoulder is we're focusing on more strengthening and stabilization of the joint as opposed to passive treatments at this time. We set her up on a custom program where we started her off at 50 milliwatts for 3 minutes per point for a total of 4 to 5 points over the painful shoulder region. And as she was responding better to treatment, we increased the intensity to 100 milliwatts at 3 minutes per point. We used the multi-probe because it was able to get a larger area of a larger injury area as opposed to the single probe. She's so far had about 20 plus treatments to date. She's got a comprehensive a rehab program, and also provided her with chiropractic treatment, and I've taped her shoulder for stability, and she's received some massage therapy along the way. So the clinical outcome thus far is there's been a decrease of pain and an overall increase in her left shoulder range of motion by 50%, but she's still feeling the pain, and it's been a very long time, so I actually referred her to an orthopedic surgeon that I work with in the area for a surgical consult. So she's not a candidate for surgery at this time, so he's trying some different therapies with her, so we'll see where that goes. Case study number 2 is of a 60-year-old male who presented to the clinic with a left foot crush injury, and he sustained a Lisfranc's fracture as a result of a work-related injury. Also, he had a wound over the left foot where the injury occurred. The patient was referred to our office from an orthopedic surgeon. The injury occurred in June of 2011, and due to some miscommunication between the patient and WSIB, he started treatment in January of this year. So prior to starting treatment, we had to confirm that there was no present infection within the wound, because when I reviewed the clinical notes that the patient brought in, there was indication of a bacterial infection. And you should know that one of the contraindications to laser therapy is you cannot provide the treatment when there's an active bacterial infection over the injury site, because the laser is light therapy. It's initiating healing. It's going to be flushing in fresh blood, fresh nutrients, which is a source of proliferation for the bacterial infection. So once we had determined that the patient was not, the patient did not have an active bacterial infection over the area of injury, we started out with the wound protocol. We set him up at 30 milliwatts, 2 minutes per point using the multi-probe. And the patient, he wasn't complaining of pain or burning or anything, he just complained of a tingling sensation, and that definitely wasn't normal, and we're still not sure why that occurred, so we had to rethink our procedures. So we decreased the parameters and we increased the time. So we tried to keep the same amount of energy, but we're trying to spread it over a longer period of time. And we also started treating another area that was very tender and swollen. We kind of left the foot alone for a bit, and we then slowly came back to the foot, and his tingling feeling decreased, and then as he was responding better to treatment, we then increased the intensity to 25 milliwatts for 2.5 minutes per point. We did about 4 to 5 points over the foot, and including the ankle mortise joint. He's had about 20 plus visits to date, and we're using the multi-probe. We also provided him, he was also seen by the physiotherapist, who provided him with a comprehensive stretching, strengthening, and stabilization program. He's also been given a home exercise program, and we provided him with custom-made orthotic inserts. So the clinical outcome is that there's been decreased swelling and pain for the patient. He's able to now ambulate without the aid of crutches or his cane, which he was doing initially, and the skin in the area of the wound has definitely healed. He still has pain when he walks. He's still limited in his ability of how long he can walk for, but he's definitely much better than he was, and he's still coming in whenever he can for his treatment. I guess the sad thing in this case is he was just, when he went back to his orthopedic surgeon, he was told that one of his surgical screws had broken off, and they have to go in and do another surgery to remove that broken piece of hardware. So he's definitely upset about that, but we've reassured him. We tried to explain to him that, you know what, once the surgery's done, you're going to come back in. We're going to help you out with the laser therapy. We're going to help you out with the rehab, and you should be back to where you are real quick. Case study number 3 is a 45-year-old male that presented to our facility with bilateral foot pain. He was referred to our office by his family physician, and he'd been recommended for orthotics. So after doing our exam, I diagnosed the patient with severe pes planus with associated bilateral plantar fasciitis. His treatment consisted of laser therapy, and we did some chiropractic treatment for lower extremity, and we also provided him with a comprehensive active rehab program involving stretching of the plantar fascia, stretching of the tibialis anterior, and a strengthening program. So we used the plantar fasciitis protocol, which comes with the Theralase unit. We started him off at, I think, about 40 milliwatts, and then we had to increase that to about 80 milliwatts at about 2.5 minutes per point just to obtain a therapeutic benefit. I'll explain why we did that at the end of the slide. We used the multi-probe, and then once he got his custom orthotic inserts, he was able to transition once again into wearing them with less pain and discomfort during the 2-week period. But he also wanted to continue with a few more sessions of the laser therapy because he was realizing that one of his enjoyments was to take an evening walk with his family, and prior to coming to us, that was very limited, or he was not even able to do that. So he came in for a few more sessions. So he came in for a total of about 15 sessions. So the clinical outcome for this gentleman was he had decreased pain, decreased swelling, and at the end he was able to go for a walk in the evening with less pain. The patient came back to our office this year for a referral for another pair of orthotics, and he also had a referral for compression socks. And he told me, well, he goes, I could probably get these compression socks at the hospital, but is this a service that you provide? And I told him, yeah, we do. We're certified in providing the service, and he was quite happy with that. So it just goes to show that this was a satisfied patient. We had come in for orthotics, and then he was referred for another service, and he wanted to see if we could provide him with that service first before he thought about going somewhere else. Now, the important thing here with this case study, and also with all patients who you provide low-level laser therapy for, is you got to consider patient factors. This gentleman was 300 plus pounds, and when we started we started him on the plantar fasciitis protocol. I think it starts at 40 milliwatts, and 40 milliwatts for this gentleman was not enough, so we had to increase it. We basically doubled it to 80 milliwatts. I think we even took it up to 100 by the time we were done with him, just to obtain the proper therapeutic benefit. But you always have to look at the patient in front of you. Is it a geriatric patient? Is it a pediatric patient? Is it an athlete? Is it an individual with darker skin? One thing to keep in mind, individuals with darker skin, Afro-Canadian patients, for example, they're going to have a lot more melanocytes in their skin. And what melanocytes do is they actually absorb the light energy. It prevents it from reaching the level of the cells to cause a therapeutic benefit. So if the melanocytes start absorbing all the energy, the patient will feel pain and discomfort, and you're creating like an internal microwave. And I kind of learned this, I guess, almost the hard way. We had a patient when we first got the unit. She was Afro-Canadian. She was coming in to see me for plantar fasciitis, and we had gone about 3 sessions, and on the 3rd session she told me, listen, the last 2 sessions you've asked me how I feel, and I don't feel better at all. It's uncomfortable when I'm getting the treatment. It's uncomfortable when I go home. I'm not sure if this is for me. So I quickly, I explained to her that, let's try it one more time. Let me look at what's happening, and we had to look at the patient factor. So for her, we had to decrease the intensity of the laser, and we increased the time. So she was still getting the same amount of laser, but we're spreading it over a lot longer period of time, and then she started to respond better to treatment. The last case study is about a 26-year-old male. He presented to the clinic with right shoulder pain for a duration greater than 1 year. He was a bit of a challenge because he didn't know how he had injured his shoulder, his left shoulder, and he wanted results basically yesterday. And so we had to kind of explain to him what the procedure was, what we're going to do for him, and he was willing to give it a try. So I diagnosed him with left supraspinatus tendonitis. I provided him with a comprehensive exercise program that he conducted at home and in the clinic, which involved stretching, strengthening, and stabilization of the entire rotator cuff complex. We were using the rotator cuff protocol that's found on the Theralase unit. We were at about 80 milliwatts for 3 minutes per point at 4 to 5 points over the left shoulder, over the tender sites. We were using the multi-probe, and he had completed 10 sessions of treatment before he just disappeared. Not quite sure why he stopped coming. We did call him, but he had a couple of relapses along the way. He'd gone on holidays. He said he'd just been a little too crazy, hurt himself, and he'd come in and he was doing okay, but I just don't think he was committed enough to the treatment. And if he'd had a few more sessions, I think he would have done better with the response to treatment. So, like I said, we had provided him with an active rehab program, which was focusing on stretching, strengthening, stabilization of the left shoulder, left rotator cuff complex, and I also taped his shoulder for stability and provided chiropractic treatment. So the clinical outcome was decreased pain, decreased swelling with some increase in strength, but I still think he could have done a lot better if he had kept coming in. So I want to thank everybody for participating in today's web seminar. I'm going to defer to Dr. Rhonda Moshton. She's going to take some of your questions.
Hello. Thanks very much, Dr. Varani. That was great information. I just want to remind everyone to please type in your questions. Just in a few moments, we'll be taking questions. I will be reading out the questions, but Dr. Varani will be responding to all the questions. So please type away. Meanwhile, while we're just waiting for the questions to come in, just wanted to let everyone know about a couple upcoming events. Firstly, on Saturday, June the 9th, we'll be presenting a full day, 6-hour certification laser seminar in Lombard, Illinois. That is just outside of Chicago at National University of Health Sciences. That'll be presented by Theralase, sponsored by NUHS. That'll be worth 6 CE credits. And our next webinar will be on Wednesday, June 20th. It'll be on how to choose the best laser for your practice, full of valuable information on laser parameters and the different factors you need to look at when considering different laser technology. We always get questions about how to receive copies of the webinar. In fact, I saw already one of these questions have come in. So just to remind you that within the next hour or so, you'll receive a follow-up email from GoToWebinar. So it won't come straight from Theralase. I believe it'll come from GoToWebinar. And that follow-up email will have a survey attached to it. If you fill out that survey, it's a very short survey, complete the survey and return it to us, you'll automatically be sent out a copy of the webinar. And we do that for all of our webinars. So within a week or so, you should receive a copy of the webinar. If you don't receive it, you can just email me at rmostyn@theralase.com. That's rmostyn@theralase.com. And I'd be happy to send that off to you. So without further ado, we're going to get into our questions now. Here we go. So we have a lot of questions. Hope to get through as many of these as possible. Hold on. Okay, hold on one more second here. Okay. One question I have here, I'll actually just accept this question, and I'll pass the next one on to Dr. Branny, is can the laser be applied to the growing joint of kids? Yes, we know that you can apply laser to growth plates. We do treat children over growing limbs safely with the laser. Next one is, and Dr. Branny, I'm going to send this one off to you. Do you bill HST on the laser component of the RMT services or just on the massage services?
We bill it on the whole procedure. So if they're coming in for the massage therapy, and say they're coming in for a 30-minute session. So what we do actually, if it's 15 minutes of laser therapy and 15 minutes of massage, so it's $50 for the massage therapy session. It's $10 additional for the laser. So we're actually billing for the massage therapy session, which is $50 plus HST plus the $10, which is separate. So it's just for the massage therapy session.
Okay, that's great. Thank you. Next one is cancer a contraindication?
Absolutely. That's the best way I can explain it.
Yeah, that's I would agree with that. We see cancer, whether it's benign or malignant, as an absolute contraindication. There are some cancers that actually will recede with laser. The problem is that we don't know which are going to grow and which will recede, so we just say to play it safe and don't treat over any type of cancer. Do you know if WSIB, or workers' compensation, would cover laser for a medical doctor or a naturopathic practitioner that may be using the Theralase?
I don't know about that right now. I'm sorry, no.
Okay. What I've heard before is that WSIB covers services. They don't cover specifically laser therapy, but they cover on a per-service basis. So it would be for a medical service or a naturopathic service as opposed to specifically a laser therapy service. So you might include laser therapy into your medical or naturopathic procedures. That might be part of your service, but it'd be billed under the service provider. Here's another one here. This is an interesting question. Dr. Varani, during your research on therapeutic cold laser, did you evaluate other modalities such as shockwave therapy, infrasound? They might mean ultrasound there. If so, what is the main treatment difference with the other modalities, and what led you, I'm just throwing this in, what led you to go with the cold laser?
Well, that's a good question because we do have a shockwave unit at one of our offices, and both units are great, but they also both units can be applied specifically to certain patients. For example, if I got a patient coming in with osteoarthritis of the knee and it's a senior patient who's about 70 years old, I'm definitely not going to be using shockwave because shockwave is very intense. It's basically sound waves impacting the injury site, and it can be very tender. a lot of my patients who are undergoing shockwave therapy for example, for a shoulder injury or for a shoulder tear, I let them know that you're going to leave here feeling discomfort for the next couple of days, and that pain should then resolve slowly. So it's, I guess to answer the question best, is we kind of look at who the patient is, and then we try to fit them with the best appropriate treatment modality and go from there. And if that first treatment modality is not as effective, then we'll definitely look to shockwave therapy if it's appropriate.
Thank you. There's a couple questions that we've received about CPT codes that are used for laser treatment in the U.S. For those people inquiring about CPT codes, I will get back to you with a list of codes that we recommend. There's several codes that could be used. Generally, they'll cover a portion of the treatment, not necessarily the whole treatment fee, but there is some reimbursement for laser if you do use the appropriate coding. So I will get back to you privately with a list of those codes. Okay, so there are several other questions here about contraindications. One is about pregnancy, one is about age, and just to respond to these, pregnancy is not a contraindication, but treating over a pregnant belly is a contraindication. So just don't treat it right over the pregnant belly. And is there any age limitation for laser therapy? We do treat young patients, we treat older patients, but what we do is we adjust our dosing based on age. So for a young patient, we'll give them maybe half the dose of an adult or even less. And for a very elderly or frail patient, we might also reduce our dose. So the age might determine what dose that we're going to use. One last question here we're going to take in, and I'm sorry if we don't get to all your questions. I will try to get to those, or Dr. Brandy will get to those afterward, through your private email. But the final question, Dr. Brandy, is when a new patient comes into your office or into your clinic, how do you decide which practitioner in your clinic will see that patient for laser treatment?
Well, that's a good question. It depends on a few factors. So if the patient walks into the office and if they come in with a medical referral, it specifically says physiotherapy, well then we're going to let the physiotherapist assess the patient, and if there's multiple complaints for the patient, then we'll probably involve the massage therapist or the chiropractor also. So we'll kind of split it up a little bit where the physiotherapist will take one part of the injury and may provide laser therapy for that, and the chiropractor may treat another area with laser possibly, or with other interventions like chiropractic treatment. If the patient just comes in and the referral is very general, treat at the discretion of the clinic. In my 11 years of practice, I've realized, like, I've been working with physios for about 8 years now, and I've realized that physios are very good for extremity injuries. So we usually refer that out to our physios, and for neck and back pain, the chiropractor is usually the primary practitioner.
Thank you, Dr. Brandy. That's all very valuable information. Thank you for presenting today's webinar, and I also want to thank all the attendees of this webinar for joining us. Please join us in our upcoming webinar on Wednesday, June 20th, and hope you enjoyed this broadcast. Have a great day.
Hello, Rhonda.